Great. Well, thank you, everyone. Welcome to today's call. I'm Annika Isagiri. I'm Communications Director with the Committee to Protect Healthcare. We appreciate you joining us today after Senator J.D. Vance's visit to Tucson yesterday to hear from Arizona physicians about their concerns regarding his and former President Trump's healthcare stances. Before we begin, I'd like to state that these physicians are speaking as individuals and with the committee, not necessarily on behalf of any employers. So we please ask that you only refer to them in your coverage as they introduce themselves on the call. So thank you in advance for being respectful of that. I will now introduce our first speaker, Dr. Goodrick.
Hi, I'm Dr. Gabrielle Goodrick. I'm a family physician and an abortion provider in Phoenix, Arizona. When Senator J.D. Vance came to Arizona yesterday, he talked about early voting. He talked a lot about immigration. He talked a lot about the Arizona heat, but he didn't talk about healthcare. As Arizona physicians, we're here today because our patients and all Arizonans deserve to hear from former President Trump and Senator Vance about their real plans for healthcare. We're here because healthcare, including reproductive care, is central to the well-being of families in my community, and the transparency from our leaders is crucial. J.D. Vance and Donald Trump's statements regarding abortion access have been inconsistent at best and truly dangerous at worst. As someone who provides comprehensive care to families, I know how important it is for people to have access to safe, legal abortion when they need it. Arizonans deserve to know if these candidates will stand with patients or if they plan to strip their reproductive freedoms away. Without clarity, voters cannot make informed decisions about who they feel is best equipped to protect their health care. Yet J.D. Vance didn't feel the need to talk about reproductive health care yesterday. A look at his record may show why. J.D. Vance has indicated his support for a national abortion ban on many occasions. At the recent vice presidential debate, he tried to pass a ban off as a minimum national standard, just a nicer sound for the term for a ban. Vance has stated that he doesn't support exceptions to abortion bans for rape or incest, saying two wrongs don't make a right. He even suggested that rape resulting in pregnancy was, quote, inconvenient. These sorts of statements are extreme, plain and simple. Yet now J.D. Vance, like former President Trump, is trying to come off as moderate on abortion. There's nothing moderate about forcing survivors of rape and incest to carry their attacker's baby. There's nothing moderate about allowing a national abortion ban to interfere with life-saving medical care. There's nothing moderate about politicians making personal healthcare decisions for women in America. So as physicians, we are not going to let Vance and Trump keep flip-flopping on an issue as critical as reproductive health care. My patients deserve leaders who will stand firm in their healthcare policies and have the track record to prove their commitment to protecting patients, not politicians who treat healthcare as a political football. Thank you. Now I'll introduce Dr. Underwood.
Great, thank you, Dr. Goodrick. Hi, I'm Dr. Paul Underwood. I'm an interventional cardiologist and clinical researcher based here in Phoenix. I also chair the board of the Association of Black Cardiologists, and I'm on the council of the Arizona Latin American Medical Association. As Dr. Goodrick noted, reproductive health is a critical component of healthcare and one that neither Trump nor Vance has had a very good record on. But it's not just reproductive health that they threatened or that they refused to talk about during their campaign rallies. Senator Vance also failed to discuss the Affordable Care Act or the Inflation Reduction Act. As a cardiologist, I treat patients with chronic conditions such as heart disease, the leading cause of death in America and the developed world, conditions that require ongoing care and access to affordable medications. The Affordable Care Act is essential for many of these patients, providing the coverage they need to manage their health without financial ruin. It is well documented that people who gain coverage through the ACA have grown healthier and more financially stable. The Affordable Care Act also led to significant reductions in uninsured Americans, particularly in groups that have been marginalized by America's two-tiered healthcare system. These are Blacks, Latinos, and American Indians. States that had expanded Medicaid coverage in accordance with the law have demonstrated improved health outcomes when compared with non-expansion states. In addition to lowered rates of uninsured citizens, the benefits of the Affordable Care Act that expansion states have experienced include reduction in uninsured emergency room visits and the establishment of minority health offices and HHS agencies. And these have yielded important policies such as those regulating clinical trial diversity, as well as access to medications. I personally witnessed the power of the Affordable Care Act when one of my family members was able to receive previously unavailable curative therapy for hepatitis once the law was passed. Similarly, many patients with heart failure that once relied on the emergency room when their condition became intolerable can now receive ongoing management through clinic visits and affordable medication. Without the Affordable Care Act, many patients with pre-existing conditions would be left facing insurmountable medical bills or even denied care altogether. The ACA has been a lifeline for millions of Americans, including 339,000 Arizonans newly enrolled this year alone. In fact, ACA healthcare programs have increased by 150% since 2020. For those of us in the medical field, this act has allowed us to better ensure our patients receive treatments they need without the constant fear of financial devastation or prioritization of limited resources. Perhaps Senator Vance failed to talk about the ACA because Trump's dismal history with it. During his presidency, Donald Trump repeatedly attempted to repeal the Affordable Care Act. He undermined outreach efforts and slashed enrollment time. The uninsured rate rose under Donald Trump. During the vice presidential debate, Senator Vance tried to falsely claim that Trump saved the ACA. In reality, the Affordable Care Act was lucky to have survived the Trump presidency. We have seen Trump and Vance continue to skirt questions about healthcare agenda, with the closest we've come to hearing about the ACA replacement being concepts of a plan. The former President Trump mentioned last month during the concepts of a plan that were mentioned last month. This ongoing sidestepping of Americans' concerns about healthcare issues is causing confusion, making it difficult for my patients to know where Trump and Vance truly stand or what they'll do if elected. Voters deserve to know exactly what they're voting on and the platforms these candidates stand on. My patients deserve leaders who are transparent and committed to improving their health through our healthcare system, not those who want to keep us in the dark and force us to react to the draconian consequences of their decisions. Thank you. I'd now like to introduce Dr. Eve Shapiro.
Thank you, Dr. Underwood. This is Dr. Eve Shapiro. I'm a pediatrician in Tucson. And as a pediatrician, I see every day how access to healthcare is critical for children and their families to be able to remain healthy, learn, work, live, and thrive. I've seen how policy changes can expand access to care and make our families, communities, and our whole state stronger. I was proud to chair the committee in 2000 that passed Prop 204, the proposition that expanded Medicaid coverage to all Arizonans who earn less than the federal poverty level. That was a huge step forward for the health of my patients and families across Arizona. Another huge step was, as Dr. Underwood mentioned, the Affordable Care Act. And yet another more recent step was the Inflation Reduction Act. This law, which Vice President Kamala Harris helped pass, has resulted in huge healthcare savings for seniors. The Inflation Reduction Act finally gave Medicare the power to negotiate drug prices. Now 10 common prescription drugs cost less, and Medicare will continue negotiating prices for other drugs. The Inflation Reduction Act also capped monthly insulin costs for seniors at $35 per month and prescription drug costs for seniors at $2,000 a month. And the Democratic plan is to expand the caps on insulin to everyone who needs it. We have a long way to go before we can say that all Americans have access to quality, affordable health care. But the ACA and the Inflation Reduction Act have made real progress. Despite their waffling on these laws, it's clear to us that Senator Vance and former President Trump want them gone. Trump has vowed to repeal the Inflation Reduction Act, and Project 2025, the blueprint for a second Trump presidency, written by 140 of his former aides, calls for its repeal as well. Project 2025 also spells disaster for reproductive health care. Project 2025 rejects the notion that abortion is health care. Trump has tried to distance himself from Project 2025, but he is on record indicating support for a national abortion ban. And the state abortion bans that he paved the way for are already causing irreparable harm to women in Arizona and across the country. We've all heard stories of women being denied care, turned away from hospitals because of dangerous abortion bans. So even if Trump and Vance continue to hide their national abortion ban plans, we can't forget their support for dangerous state bans. When Vance and Trump say that states should decide, we must remind them that states don't have abortions. Women have abortions, and all women, all Arizonans, all Americans deserve affordable access to the care they need. And voters deserve to hear from Trump and Vance about their real healthcare agenda. Thank you.
Thank you so much, Dr. Shapiro, Dr. Underwood, and Dr. Goodrick. We'll now allow time for questions. If you have a question for one or any of all of the physicians, you can go ahead and ask that. You're welcome to do so using the chat function, or you can use the Q&A function, or if you prefer, you can raise your hand and I can allow you to unmute to ask your question verbally. So we will allow a few moments for folks to be able to type those questions or raise their hands. Yes, Stephanie, you should be able to talk now.
Okay, hi. Yes, I'm Stephanie Innes from the Arizona Republic, and this is not directly related to Vance, but I did want to ask the physicians what they think about a group that started promoting themselves this week called Physicians Against 139. They're saying they're a group of more than 100 medical professionals who are against the 139 and see it as a danger for women in the state. And I wanted to ask if you think this represents a large group of physicians and what you think in general of it.
I can try to speak to that. I haven't heard of that group. I imagine many of those physicians don't live in the state of Arizona because the Proposition 139 is going to save lives. It's going to save lives. Right now, we're existing under an abortion ban here in Arizona, and it has caused terrible health issues. I've seen patients suffer, having delays in medical care, not being quickly treated for ectopic pregnancies, not being treated for early labor. So the proposition is, is a good thing, and it will help patients' health. So, and I don't know much about that group. I haven't heard of it.
I could just add, I've never heard of that group either, and certainly no physician I know would support their position.
Right. And I agree. And the groups that I have been associated with have not been approached by that group as well.
Thanks, Stephanie.
Thank you.
Great. I also had a question chatted to me. I'm putting it in the chat for panelists. In a different campaign event recently, Senator Vance mentioned that a second Trump administration may defund Planned Parenthood. What would that mean for patients like yours?
Well, again, I can speak to that. In rural areas and other areas, Planned Parenthood plays a crucial role in preventative health care for Arizonans and people around the country. And defunding that, most of Planned Parenthood's funding comes through Medicaid programs, like I said, providing health care for rural, poor minority women. So that would be extremely harmful to patients if they didn't have access to that, because they provide a lot of primary care and, like I said, preventative medicine. And that would cut that off for those patients.
And if I could add, I think 90% of the patient visits to Planned Parenthood are for family planning, sexually transmitted disease treatment, not abortion. So if that funding was cut out, the problem would be that women couldn't access birth control, and the unintended consequence would be an increase in unwanted pregnancy. So I'm not sure how that would help this situation at all. So yeah, that would be a crazy idea. And I think they tend to equate Planned Parenthood with abortion, but actually, as Dr. Goodrick mentioned, they provide many preventive services that are really essential.
I agree. And actions in that way really discourage physicians from coming to our state. And if that continues, then it makes it difficult for the medical community to take good care of their patients. Likewise, efforts that are done to reduce healthcare only raise barriers to those wanting to gain access. And so this will do nothing to reduce disparities. It does nothing to improve the care of, in this particular case, women, or to improve our medical community's ability to care for the patients.
Thank you all, and thanks for the question. We'll allow another minute for any follow-up questions. In the meantime, I wanted to mention that I have been recording this, so if you'd like a copy of the recording, you can send me a chat right now or send me an email where you RSVP'd, and I'd be happy to get you a copy of the recording as soon as I can after the call is done. And I am not seeing any other questions, so we will go ahead and conclude today's call. Thank you for the media who have joined today. I know it's a busy time, and we appreciate you being here to hear from physicians. And thank you so much to our physician speakers, Dr. Goodrick, Dr. Shapiro, and Dr. Underwood. We appreciate your time and your advocacy today.
Great. Thank you.
Thank you.
Thank you so much.
Thanks, everyone.